Assalamu alaikum everyone. In this video, I am going to differentiate between a diffuse and the limited scleroderma. So first, I am going to define scleroderma. Scleroderma is an autoimmune connective tissue disorder in which there is a widespread fibrosis occur. So we have two types of scleroderma. One is the diffuse scleroderma, the other is limited scleroderma. In the diffuse scleroderma, there is a widespread skin involvement. Most of the body skin is involved in the diffuse scleroderma. While in the limited scleroderma, the skin of the face, the skin of the neck, and the skin of the digits are involved. So the first sign that appear in the scleroderma is the renal phenomena. In the diffuse scleroderma, there are rapid onset of symptom after the renal phenomena. While in the limited scleroderma, there is delayed onset of signs and symptoms after the renal phenomena. The third differentiating point between the diffuse and the limited scleroderma is the cell involvement. In the diffuse scleroderma, there are significant visceral organs are involved, such as the lungs, the heart, GT, and the kidneys. And I have already talked about that there are fibrosis occur. So there is fibrosis occur in the lung, the heart, GI tract, and the kidneys. In the limited scleroderma, the visceral involvement are rare but can occur late in the disease. Pulmonary hypertension can be developed and ischemic vascular diseases can be developed. Now, in the diffuse scleroderma, anti-topoisomerase 1 is positive mostly. This is the antibody, anti-topoisomerase antibody. The another name for anti-topoisomerase antibody is the anti-scleroderma 70. While in the limited scleroderma, anti-centromere antibody is positive. So the diffuse scleroderma has the poorer prognosis. 10-year survival rate is 40 to 65%, while the limit is better prognosis than diffuse form. So the peripheral edema of hands and legs, polyarthritis, fatigue, and weakness, and carpal tunnel syndrome can be developed in the diffuse scleroderma. Renal failure can also develop, and interstitial lung disease are more common in diffuse scleroderma. While there is a variant of the limited scleroderma which is called a CREST syndrome, here you can memorize the clinical feature of the CREST syndrome. C here stand for the calcinosis of the lung, calcinosis of the digits, in which there are calcium deposition occur in the digits. The R for Raynaud phenomena, and the A for the esophageal motility dysfunction, and the S for sclerodactyly of the finger, in which there is tightening of the skin occur in the fingers, and the T for the telangiectasia, in which the vessel become enlarged mostly over the digits and under the nail.